As we mark World TB Day, the World Health Organization is calling for urgent action. It's calling on countries to implement priority recommendations from the 2020 Progress Report on TB. They are also concerned now that as the world is focused on dealing with the COVID-19 pandemic, some of the gains of the TB fight might be lost. This year's theme is "The Clock is Ticking." Dr. Michel Gasana from the National TB Program in Rwanda joins us now. A very good morning to you, Dr. Michel, and thank you so much for your time. So, of course, COVID-19 at the moment is the focus, but there is concern that TB, which is one of the biggest killers around the world, not even just here in South Africa, is losing the focus that it supposedly deserves. Is that still really much a great worry for the WHO and, of course, your organization?
Yes. As you know, today is a World TB Day, and the theme is very clear. The clock is really ticking, and in Africa, as you know, we have many challenges for tackling TB. And it's very necessary that we have to accelerate and to make sure that, our targets are reached. So if we can say in terms of different, challenges that we are facing in Africa to address TB issues, the one, as you know, the African region continue to bear a significant proportion of TB. And it's accounting for 25% of the estimated, 10 million incident tuberculosis cases that, occurred worldwide for last year. So the problem is that in Africa we have around 1.1 million people who were undiagnosed, who were not reported. This has, as a consequence, we have more than 40% people who missed out, on access to quality TB care, and other consequences that TB. Patients continue also to transmit the disease.
Dr. Michel, in the time of COVID, I'm sorry to just jump in there, in the time of COVID-19 and the African countries struggling with that as well, how best can we deal with TB and make sure that it does not get out of hand?
TB was really affected by COVID because, as you know, the first problem we had with COVID is that, COVID-19 pandemic has made, access to TB service more difficult. For instance, if I say about, South Africa, we can say data collected last year showed that, monthly notification of TB cases fell by more than 50% between March and June, which really is the sharp drop in TB notification. And as a consequence, for TB-19 threatens, to reverse the progress that we have made, you have achieved. This is not good for us, and the WHO has conducted, has done a modeling. WHO modeling suggests that, if you have like 50% drop in TB detection over 3 months, this also can result in 400,000, additional deaths. So we see that, this was not good with, this was the impact in terms of notification. And also this can be really explained because, as you know, for some countries during, COVID-19, TB staff and even for some countries, testing equipment also were reallocated to COVID-19 response.
Yeah.
So this affected TB for some countries. And also, we can say also as TB and the COVID-19 are having the same respiratory symptoms. This also had affected because people were afraid to attend the health services, and also the lockdown contributed a lot, for this.
Yes.
So for maybe other issues was that, as the economic impact of COVID also is worsening the key social determinant of TB incidence. And also this can also affect the percentage of households, facing catastrophic costs.
Yes.
This were really the difficulty that, we faced during this. And also for some countries, we have the disruption of continuity of essential health services, including TB.
Dr. Gasana, unfortunately, I just have to jump in there, and we have run out of time, unfortunately, but the gist of the point that you were making has been heard. That's Dr. Michel Gasana from the National TB Program out in Rwanda.